Good morning, everyone, and welcome to Reading Medication Labels, How to Interpret Information on a Prescription and Non-Prescription Packaging. My name is Allison Burns. I am a registered pharmacist. Today is June 8th, 2021, and let's jump right into it. I do not have any financial interests or relationships to disclose. We would like to give a special thanks to our partners over at the Bureau of Substance Addiction Services, BSAS, and of course, our funders at the Massachusetts Department of Public Health. Our learning objectives today is I would like you to be able to name the 3 types of medicine labels, to identify where to find information about dosage and directions, transcribe information from a label to a medication tracking sheet, and explain what to do if a medication is mislabeled or mispackaged. Getting to know your medication labels. Medications, as you know, can be packaged in many different ways. Some are in vials, others are in sealed containers or blister packs. But regardless of how they're packaged, the FDA requires that every prescription, over-the-counter medicine, and dietary supplement is labeled with instructions for use and the suggested amount that can safely be taken at one time. Understanding the components of a label can be especially difficult if the medication is not for you. So learning how to read and interpret the information on labels is what will help support safe use of medications and help prevent costly record-keeping mistakes and medication errors. So what are our labeling and packaging requirements? There are some BSAS regulations in 105 CMR 164 shown below. All prescription medications, they must bear the pharmacy label, meaning the label that they are dispensed in. This label contains the following information. I don't want you to worry about looking for this information to make sure that the pharmacy label is in fact accurate. This information is actually required also by the Massachusetts Board of Registration in Pharmacy. So it will automatically include these components, which are the date of filling, the pharmacy name and address where the medication was in fact dispensed, the serial number that is associated with that prescription, the pharmacist's initials who filled that prescription, the name of the prescriber or the practitioner who prescribed the medication, the name of the resident, the name of the medication itself, the directions for use and any cautionary statements, and if tablets or capsules are used, the number in each container. For all your over-the-counter medications and supplements, these must be kept in those original containers with the label, which include the directions for use. Again, this is just a repeat in layman's terms of what I went over. Again, every prescribed medication, it must be presented from either the resident or that delivering pharmacy in the original container. That means the vial, package, bottle, blister pack, etc., that it was dispensed from the pharmacy in. Every non-prescribed or over-the-counter medicine, so those purchased in a store, must be kept in those original labeled containers that they were purchased in. You cannot accept medications that are unlabeled or mispackaged because it is a significant safety concern. There really is no way to verify what that medication is, who it's meant for, how to take it, or when it expires. And remember, removing the medication from the original packaging can actually damage or inactivate it. The packaging that a medication is dispensed or purchased in is actually approved by the FDA. They set certain standards, and these standards meet temperature controlled measures. So what I mean by this is medications are sensitive to light. They are inactivated by direct sunlight. They're also sensitive to swings in temperature and moisture, humidity in the air. So removing it from that original packaging actually could compromise the integrity of the medication itself. You want to get a supervisor immediately for any of the following situations. If a label is missing, partially ripped off, or cannot be read. If it is not in the original container, meaning, for example, if it's in a plain manila envelope or a Ziploc bag, if the prescription medication does not have the resident's name on it, if it does not have directions for use or a recommended dose or amount to take, if it is loose pills or mixed pills, if it's an unmarked blister pack or just loose unit doses, so meaning a blister card that has been removed from a larger box or container, or if the medication does not match the description that is on the container. We will give an example of one of these types of labels later in the presentation, but just so you know, many packaging does actually have a description of what is inside. So on the left side, these are all the acceptable labeled and packaged items that can be brought. So you can see you have a labeled vial, you have a Centrum multivitamin in the original package, you have a blister pack with the appropriate label at the top, and at the bottom you have a box of amitriptyline medication. Again, it's in the original packaging with the instructions. On the right side of your screen, you're going to see some items that should not be accepted. So the first items are those loose unit doses or unmarked blister packs. These tablets and capsules belong in a larger box or container. They should have been left in those containers. Then you have a Ziploc bag that has multiple mixed medications in it. Then you also have a unmarked vial. And then you have a manila envelope, which may in fact include the correct medication name. It might have the correct resident name. However, it's not the original packaging that it was dispensed in, and therefore we can't verify that that is actually in fact what's inside. Of course, when a resident shows up with a medication that has been mispackaged or unlabeled, the program should make every reasonable effort to prevent any gaps in care. And what I mean by this is supporting that resident you may require them to in fact get a new properly packaged and labeled supply, but you should support them if you're going to require this. And what I mean by that is call the local pharmacy for a refill or help them contact their provider for a new prescription. Let them know they need to purchase a new bottle for over-the-counters or those supplements. Definitely explain to them why they need to do this and why it's important for safety. Now, if the resident was transferred from a CSS, a TSS, or another treatment setting with a mislabeled or mispackaged medication, you can contact the facility. I recommend doing that as soon as possible. You can either request a new supply. If they had a prescriber there on site that prescribed that medication, you can ask them to send a new prescription to a local pharmacy so it can be properly dispensed with the proper labeling. Of course, the practitioner is not required to do that, but you can request a new supply. You could also request, as a last resort, to get a written confirmation of the mislabeled supply. If you are requesting a confirmation of what was sent over that was mispackaged or mislabeled, this is what you are going to want to ask for. Verify that name of the resident, full first and last name, the name and strength of the medication, the dosage, so the resident's prescribed dose, the directions for use, an actual physical description of what that medication looks like. Remember, there are many different manufacturers out there. One medication can come in many different sizes and shapes. Get that physical description to make sure that's absolutely what you have in the bottle or package. Make sure you get the quantity that the resident was transferred with, the name of that prescribing practitioner, the date the medication was dispensed, meaning the date it was filled, and the expiration date. I want to draw your attention to what I mean by the difference between name of the medication and strength of the medication. First, the dose. For example, if I am prescribed gabapentin 600 milligrams, the name is gabapentin, the strength is 600 milligrams. However, I take 1 tablet twice a day. So my dose is 2 tablets, which means it's actually 1200 milligrams. So here, name would be gabapentin, strength is 600 milligram tablet, dosage is 1200 milligrams. My directions for use is 1 tablet twice a day. If you are in a treatment setting, please recognize that it is part of federal law, Code of Federal Regulations, Title 21, Subpart B. There are labeling requirements for all prescription drugs, whether they're controlled or not, and as well as insulin products. Just know that if you are transferring a patient and you are mispackaging or do not have a properly labeled container, that you may be in violation of federal law. So make sure you're sending those packages over correctly. Types of labels. So there are 3 types of labels. First, you have your prescription medications. These are going to be labeled with a prescription drug label. Your over-the-counter products are going to be labeled with drug facts, and your dietary supplements, meaning your vitamins, herbals, homeopathic, natural remedies, these are going to have your supplement facts. Prescriptions are dispensed with an RX or prescription drug label that is specific to the patient. It's going to be automatically printed on that prescription bottle or container. Whereas your non-prescription, so your over-the-counters or your supplements, which can be purchased in a store, those are going to be purchased with a fax label that is for the general public. It is going to have general instructions on it. These won't be specific to the patient, but they will be what is allowed to be safely taken by a general person. These facts are automatically printed on the manufacturer's packaging. So again, if you're ever worrying, is it a prescription or is it a non-prescription? Very easy. Prescription drug label. It's going to have a pharmacy label, as opposed to your over-the-counters and your supplements. Those are going to be labeled with facts. And you may be asking, okay, why do we have prescription and over-the-counter, drug, both bolded here? I'll tell you why. Drug label and drug facts, because prescription and over-the-counter medicines are regulated as drugs by the FDA. They are labeled with a National Drug Code, or NDC. I will show you what that looks like. Prescriptions will further state RX only on the container. And then the controlled medications are labeled with a federal caution statement, which is shown below. It will say, caution, federal law prohibits the transfer of this drug to any other person than the patient for whom it was prescribed. Dissimilarly, dietary supplements are regulated as foods by the FDA. So they will have a suggested use, which will be the directions, and a serving size, which will be the dose. They will be labeled with an FDA disclaimer. It will appear this way. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. And you may be wondering why this disclaimer is there. So OTCs, so over-the-counters and prescription medications, are drugs. They are unsafe until proven safe by the FDA. They must go through rigorous efficacy and safety standards. As opposed to dietary supplements are considered safe until proven unsafe. They are not evaluated by the FDA before they are brought to market. However, if the product itself causes harm to the public, the FDA then has the ability to pull that product from the market. An example of this is there were some weight loss products that were recently out, which were causing people to have heart complications, including heart attacks. And the FDA pulled that from the market. But again, a dietary supplement is not checked for safety and efficacy by the FDA. It is safe and until proven unsafe. That's why it has the statement at the bottom. Here you go. We have 3 products. All the way on the left, we have our supplement, our True Biotics, which is a daily probiotic. It is labeled with your supplement facts. And right there at the bottom, there's your FDA disclaimer. Middle product is an over-the-counter stool softener. It's got its national drug code, so it's NDC right there at the top. And if you flip that bottle over, you would see a drug facts. All the way on the right, we have our prescription ointment. Again, you see the NDC, RX only, and then within that package, there's the tube of ointment, which I also have shown below. Again, that manufacturer's packaging, same thing, NDC, RX only. And this would be dispensed with a prescription label. Now that prescription label would most likely be attached to that outside box, which is why really important, keep that tube of ointment inside the box. Otherwise, you are going to have a mislabeled product. For the countable controlled substances, these have further labeling requirements. The FDA requires that they are labeled with the letter C and the Roman numeral that represents the DEA schedule it falls in. So that is going to be everything in Schedule 2 to 5. An example is Suboxone. That is labeled with C3. As you can see on the box, as well as the film itself, there is a C3 in the corner, and that stands for a Schedule 3 drug. This is again required on the drug manufacturer's packaging. It's not going to be required on the pharmacy label itself, but most pharmacies will often put a C for controlled or N for narcotic either on the label, or they may put it at the beginning of that RX serial number. Prescription drug labels. Okay, the information may appear in a different order, but all labels have the following by law. They must have the patient's name, the name and strength of the medication, the dose and instructions for how often to take it, the name of the prescriber, the name and the phone number of the pharmacy where it was filled, the quantity that was dispensed, the date that it was filled. This will help you track adherence. So for example, if a resident filled a 30-day supply of a medication over 2 months ago, we most likely know that they aren't taking that medication regularly or as prescribed. It will have the number of refills left, if any, and then it will also have a prescription serial or RX number. This is going to be helpful when ordering refills, but I'm going to help you troubleshoot here. This unique number is used to track medications filled by a specific pharmacy. It is linked to the pharmacy location, not necessarily the medication itself. So say I have the same medication. Let's take that gabapentin 600 milligrams, same directions, same prescriber, everything's exactly the same. CVS on Washington Street will have a different prescription number or RX number than CVS on Harrison Avenue. So it's going to be different for every location, even in the same retail chain. It's also going to be a different number every time the doctor sends a new script, even if it's exactly the same. So if you call in and you have the prescription number and they say there's no more refills, and you know that you have another refill somewhere, it might actually be linked to a different prescription number. What I would encourage you to do is ask for the name itself of the medication. Give the name and the strength. Say, okay, there's no more refills with this number. Are there any more refills associated with this name of medication at this strength? That should help you out. Here is an example of what a pill description looks like on the side of the bottle. So just to highlight here at the bottom, blow it up so you can see it. So what it says is this is a white oval shaped tablet imprinted with 93 on the front and 48 on the back. Now, if you open up the top of that vial, all the way on the left, you're going to see a picture of what's inside. There you go. There is your metformin tablet, white oval shaped, 93 on the front, 48 on the back. Auxiliary stickers. You might ask, what's up with all these stickers all over the vials? So these provide special instructions, warning, and side effects information. They are either printed on the prescription label itself, or they may be affixed as a sticker to the container. I would recommend that you read these carefully because sometimes they may be misinterpreted based on that pictogram or simply the color of the label. There are many out there. I'm just pointing out the most common. So if you see something that says medication should be taken with plenty of water, this means at least 1 full 8-ounce glass of water. If it says take on an empty stomach, this means take at least 1 hour before or 2 to 3 hours after eating. If you see something that says you should avoid prolonged or excessive exposure to direct and or artificial sunlight, that means that the medication causes skin sensitivity and a severe sunburn could occur if you are exposed to sunlight, whether it's in a tanning bed or direct sunlight. If it says take with food, this is often a precaution to prevent nausea or any GI upset. So that means take with a small snack or meal. If you see something that says do not drink milk or eat dairy products while taking this medication, what it means is you need to avoid actually every calcium containing product, whether it's food, drink, an antacid, a multivitamin such as a calcium supplement. Anything that has calcium needs to be avoided. Why? Because the calcium can actually bind the medication and prevent it from being absorbed. So it won't work as well. You will not get the full dose of medication. So if it says do not take this with dairy, that means no calcium containing foods or products. If you see something that says it will cause drowsiness or alcohol may intensify the effects, use care while operating a machine or dangerous machinery. What I would say here is it's a sedating medication. And if you do not know how this medication affects you yet, the best idea is to probably take that at night or in the evening so you know how it affects you. For certain hormonal birth control tablets, you will see antibiotics, certain anti-infectives. They can alter the effectiveness of the birth control pills. So what this means is that individual should add a barrier method, meaning a condom, during the use of that medication and for at least 7 days afterwards. They should definitely speak to their physician, prescribing practitioner, or the pharmacist if they have questions about that. When you see something that says finish all of this medication unless otherwise directed by the prescriber, this is usually referring to your antibiotics. Even if you are feeling better, you need to finish that entire prescription because the infection could come back and the medication may not work as well due to antibiotic resistance. Rinse mouth thoroughly after each use. This is used to prevent oral thrush with certain inhalers. So you're going to want to rinse after using your inhaler. If you see a sticker that says do not eat grapefruit or drink grapefruit juice while taking this medication, that means avoid those grapefruit products. It will affect the level of medication in your body. Moving on to our over-the-counter products with the drug facts label. So good news is, unlike the prescription labels, which do have the same information, but it could be in many different places or in a different order, FDA made it very easy for our drug facts. They always have the same information, same exact sections, same exact order. This is how it will show. Active ingredient at the top, that's where you're going to find your medication name and strength. The uses, warnings, look here for who should not take a medication. So I would say pregnant, breastfeeding, any type of serious health condition, you're going to want to check that warning section. Directions, this is where you're going to see your recommended dose and instructions for use. Other information, inactive ingredients, and questions or comments. So here it breaks it down a little bit easier. So again, right at the top, you've got the active ingredients. Those are the ingredients that are making that medication work. The next section down is your uses. So these are the symptoms that the medicine is treating or relieving. Your warnings, this is where you're going to find information about possible side effects, when to talk to a healthcare professional before starting a medication, which medicines should not be taken with that specific product, and when to stop use. You're going to see your directions, next section down. That's going to be the amount to take, how often to take it, and how much you can take in one day. Other information is going to contain some other important things to know, such as how to store the medication. Most of the time, it's going to say store in a dry, cool place at room temperature, but do make sure that you read this because some medications actually require refrigeration after opening, particularly your probiotics. Next section down is your inactive ingredients. This is going to be important for anybody that has some severe allergies, including gluten allergies. So this will include information about flavoring, preservatives, or other ingredients that don't treat the symptoms, but actually are part of the tablet itself or the capsule itself. And then at the bottom where it says questions or comments, it's going to be a phone number of where to call the drug manufacturer company if you have questions about the medication. Okay, combination and multi-symptom medicines. These are by far the hardest medications to document. And this is why some over-the-counter medicines contain more than one drug, meaning more than one active ingredient. This is done because they either relieve multiple symptoms. So think of the symptoms for a cold. Could relieve stuffy nose, sore throat, headache, aches, chills, fever, all of those symptoms. Relieving multiple symptoms, or could be something where the combination is actually more effective at treating a single symptom. A good example is a migraine product. Many of these contain 2 pain relievers, for example, acetaminophen, which is the main ingredient in Tylenol, as well as aspirin. Or it may have different formulations. So, for example, a daytime and nighttime version. Now, each version will have different ingredients. Okay, audience participation. Here we go. A resident at your program picked up Tylenol, cold and flu severe, at the local pharmacy to help with some nasal congestion, a cough, and a nagging sore throat. Program engagement is very important to this resident, so to avoid feeling sleepy during groups, they got a product with daytime and nighttime pills. The resident wants to take a dose right now, but you look at the box and it looks like there's 2 sets of directions and 2 sets of pills. What do you do next? Okay, here is the back of the box. So I know it looks confusing. We're going to go through it. What I want to point out first is you have a nighttime and a daytime formulation. There is one ingredient that's different in both, and I will explain why. So you have guaifenesin that is in the daytime pill, and you have chlorpheramine, which is chlorofen. This is in the nighttime formulation. Just to put it in perspective, we often say just treat the symptoms that you have because you could be taking unnecessary medication. This is one example. Tylenol cold and flu actually includes 1, 2, 3, 4, 5 medications in it. 5 separate medications. Each daytime pill contains Tylenol, Robitussin, so dextromethorphan, phenylephrine, which is your Sudafed PE, and here's the ingredient that was different, guaifenesin, which is the main ingredient in Mucinex. So why this is a daytime medication is it actually will loosen up mucus, and this will keep you up at night because you will be coughing that phlegm up, as opposed to the nighttime pill. Still includes that Tylenol, the acetaminophen, includes the dextromethorphan, which is your Robitussin, includes phenylephrine, which is the main ingredient in the Sudafed, but it includes the chlorphen. Now, this is a sedating antihistamine, and it helps dry up a runny nose. However, it will make you sleepy during the day, which is why you would take it at night. So just know that this one package has 2 different pills and many, many ingredients. So looking at the back again, it looks like there is 2 sets of directions. Here they are. So you see on the nighttime side, take 2 caplets every 4 hours. Do not take more than 10 caplets in 24 hours. Daytime side, again, take 2 caplets every 4 hours. Do not take more than 10 caplets in 24 hours. What do you do? So it is actually a more basic concept than you think. It looks like there's 2 sets of directions, but if the FDA truly wanted this to be packaged in 2 separate ways, it would be in 2 separate boxes. Even though there is a night version and a day version, that is because the ingredient that is different in each of the pills. So the directions is the same. It is in 1 box. It is 1 medication. So it should have 1 set of directions and 1 sheet. So again, it looks like 2 sets. It is 1 set of directions. So here, again, I have a picture at the bottom there so you could actually see what does that blister pack look. You've got blue tablets for night, yellow tablets for day. Check that expiration date on the box, fill out a medication administration record or medication tracking sheet. Observe that resident take a daytime pill because right now it's 11 a.m. Lock it up with the resident's other medications when finished. Here's our suggested documentation. Again, it is 1 box. That is how the FDA intended it. So it is 1 sheet. The name, it is Tylenol Cold and Flu Severe. However, I would encourage you, I know it is time consuming, but I will explain why on the next slide, writing out those individual ingredients. You have your dose, 2 caplets, and your directions. Take 2 caplets every 4 hours, maximum 10 caplets per 24 hours. I would highly recommend putting yellow pills in the day or yellow equals day, blue pills at night or blue equals night to help that person keep track of everything. It is important, even though time consuming, to write out all of the ingredients for safety reasons. Why? Taking multiple medications with the same active ingredient can be dangerous if you exceed that recommended daily amount. A perfect example is Tylenol, acetaminophen. It is an active ingredient in over 600, yes, 600 over-the-counter and prescription medications. It is also Tylenol, believe it or not, is one of the leading causes of liver failure still in the United States and around the world, and for liver transplants. And it is easy to take more than the recommended amount if you're taking a prescription medication, an OTC, or multiple OTCs that include that active ingredient. This is why it's important to write out the ingredients. Another reason is a medication with the same brand name can actually have 2 totally different ingredients. If you are unsure of the active ingredients in either an over-the-counter or prescription medication, feel free to contact the local pharmacist or the provider for assistance. Now, here is an example of what I mean. You have 2 medications here. Both of them have the same brand name. It is Ducolax. However, it is 2 totally separate medications, 2 different active ingredients. So on the left, you have Docusate, that's actually a stool softener. And on the right, you have Bisacodyl, which is actually a stimulant laxative. 2 different products, same brand name. This is why writing out active ingredients is very important. Moving on to supplements. So because supplements are regulated as foods and not as drugs, the supplement facts look very similar to the nutrition facts that you would see on the back of a candy bar, a cereal box, a loaf of bread, or any other food product. It will list that basic information, including the ingredients and the nutritional value. We'll have a serving size, which is the recommended amount to take, or the dose in this case. You do not want to exceed that suggested serving size, or also called the tolerable upper intake limit, without speaking to a provider. This increases the risk of an adverse reaction or side effects. You also want to be cautious of any health claims on labels. Remember, under US law, dietary supplements cannot claim to treat or cure any disease or health condition. They're simply there to supplement your diet, which is why they are called supplements. Here is an example of a supplement facts label. So here we have our vitamin D. And I blew up the back of the bottle so you could see. So you've got your supplement facts. So here we go. Your dose, that is your serving size. Here it is 1 soft gel. Your directions is the suggested use. So here it is, adults take 1 soft gel daily with water and a meal. And then you want to look for that expiration date. It's not on this specific slide, but do make sure that no one is taking an expired product at your program. Now you might be asking, how do I put the name, what is the name of this medication and the strength? It looks a little confusing, so I'm going to explain it. Here, the actual name of the medication, you would want to put vitamin D3, and the strength, so there's 2 different units here. So it's actually, you could put 50 mcg, which stands for micrograms, or you could put the 2000 IUs, and these are international units. It's either or. I don't really have a recommendation either way, but do put one, either 2000 IU, or probably the more commonly used one would be that 50 mcg, which is the micrograms. All right, takeaway points. We are wrapping up. I want you to remember, always keep those medications in the original packing, never remove the label, document the entire name of the medication, including those active ingredients, transcribe the dosage and directions verbatim directly from that prescription label, drug facts label, or supplement facts label. Check those labels for any warning statements, possible side effects, when to consult a healthcare provider, and what activities to avoid while taking the medication, such as driving. Remember, those labels contain a lot of useful information, including how to store it, how to get refills, and who prescribed it. Get a supervisor immediately if you notice that a medication or supplement is unlabeled or mispackaged. And remember that understanding how to read and interpret the information on labels is critical to document directions and store medications correctly. Here is an appendix. We wanted to provide you with examples. I did say how every prescription label will have the same information, but it may appear in a different format or order. So we picked some major retailers for you. Here is the standard format for a CVS pharmacy label. It will always appear in this format. Here is the standard format for Walgreens Pharmacy. Again, the label will always appear in this format. If you have someone that goes to the VA, here's a Department of Veteran Affairs label. Someone goes to Costco, here's the standard format for that pharmacy. And then we want to provide you in one additional example of a drug facts label and a supplement facts label. Thank you again for listening. You can always reach out to us with any questions about the information that we went over. I hope you all have a wonderful day. Thank you.